In this series, we are looking at how Chinese medicine is useful in the treatment of allergic conditions like asthma and allergic rhinitis. Today, I'll be moving on to a new formula called Ma Huang Tang. In my last video, I talked about Xiao Qing Long Tang, a well-known formula for addressing runny nose and cough as seen in allergic rhinitis. Xiao Qing Long Tang is commonly used to treat exterior cold with internal fluid, which is also known as 外寒内饮. Now, what exactly is 外寒内饮? So imagine someone who just caught a cold and is constantly sneezing and dripping clear fluid from their nose. Catching the cold is 外寒and the dripping clear fluid is 内饮. This is what a person who takes Xiao Qing Long Tang should look like. The person who uses Ma Huang Tang also suffers from 外寒内饮. There is also exterior cold and internal fluids, but the Ma Huang Tang person expresses this very differently. The Xiao Qing Long Tang person's 外寒内饮 shows up as catching a cold and dripping clear fluid from the nose, but the Ma Huang Tang person's 外寒内饮 is not about sneezing or having a drippy nose. Instead, this person has internal phlegm fluids lodged in the lungs and has difficulty breathing. By the end of this video, you will understand which herbs are similar and which herbs are different in these two formulas. You will see from different perspectives why Ma Huang Tang's 外寒内饮 is different from Xiao Qing Long Tang's 外寒内饮. And you will know the pharmacology of three key herbs in Ma Huang Tang that help them exert their effects. So please listen on. I'll bring you over to my small whiteboard to show you how Ma Huang Tang and Xiao Qing Long Tang differ, even though they have very similar ingredients. I'm just writing out the ingredients in Xiao Qing Long Tang, which are Ma Huang, 桂枝, 细辛, 半夏, 五味子, 甘草, 白芍, and 干姜. Ma Huang Tang is sort of like an altered version with some ingredients removed and some ingredients added. The key ones being 色甘, 紫丸, and 广东花. Ma Huang Tang is less about wind coat on the surface and more about addressing tannin, which is internal phlegm accumulation. This is why Ma Huang Tang does not have 桂枝, but has 色甘, 紫丸, and 广东花 to achieve its intended effect of clearing internal phlegm accumulation obstructing the lungs. Ma Huang Tang is a formula used for cough or shortness of breath, especially if there is phlegm obstruction resulting in a wheezing sound, also known as 水鸡声 in Chinese. Dr. Joyce reminded that this formula is more for cold-type asthma, also known as 寒哮 in Chinese, and not for heat-type asthma, but I will discuss that in a later video when analyzing another formula called Ding Chuan Tang. Now I will be going into the biomedical research behind Ma Huang Tang and its herbs. So how does Ma Huang Tang do its job exactly? It prevents naive T helper cells from becoming Th2 and Th17 cells. In this way, Ma Huang Tang is able to prevent the release of inflammatory cytokines that would otherwise contribute to asthma. My hypothesis is that the three herbs in Ma Huang Tang, which are 色甘, 紫丸, and 广东花, are the ones behind this key mechanism. If we look more closely at these three herbs, we realize that they're not just simple mucolytics or expectorants. They are more than just a guaifenesin or fluimacil that you can find in a pharmacy. Let us dive into more biomedical research behind these three herbs. 色甘 contains a compound called tectoridin, which has bronchorelaxant effects and is able to prevent against histamine-induced bronchospasms. When the airways spasm less, they also produce less mucus. FR75, an extract of 紫丸, also known as Aster tartaricus, has been shown to reduce inflammation of the airways and prevent against bronchospasm. 紫丸is sort of similar to Ma Huang to a certain extent because it acts on the smooth muscle cells of the airway. However, 紫丸does not act like a beta-2 adrenergic agonist, so it does not cause already spasmed smooth muscles of the airway to relax, unlike Ma Huang. All 紫丸does is that it forms a shield to prevent these smooth muscles from spasming. It prevents immune cells like eosinophils and neutrophils from infiltrating the lungs and wreaking damage. This means less spasming in the airways indirectly reduces mucus production. Guantong is also known as colt's foot in European botany. In both European and Chinese herbal medicine, Guantong is most commonly known for its antitussive or cough-suppressing effects. This is because Guantong contains Caffeoylquinic acids, which block the release of pro-inflammatory cytokines that may otherwise perpetuate the cough reflex. To give you a brief summary, the herbs in Ma Huang like Shegan, Ziwan, and Guantong have anti-inflammatory, bronchodilating, and antitussive effects, which all help to reduce airway inflammation, break down mucus, and relax the bronchial muscles. If your symptoms include thick phlegm, noisy wheezing, and breathlessness, then Ma Huang may be a better fit for you instead of Xiao Qing Long Tang. This is because Xiao Qing Long Tang is more suited for an early stage cold with watery nasal discharge and milder cold symptoms without a full-blown wheeze. From a TCM perspective, Ma Huang targets Han Xiao, also known as cold-type wheezing, by clearing external cold, resolving phlegm, and stopping cough. We now know from a biomedical point of view that the herbs in Ma Huang may be able to prevent airway hyperresponsiveness, reduce histamine-induced bronchospasming, as well as prevent immune cells like neutrophils and eosinophils from causing more inflammation in the lungs. In the next video, I will be discussing another formula called Ding Chuan Tang and how it can help with another type of asthma that we see in Chinese medicine, which is heat-type asthma. Thank you so much for watching, and I hope to see you in the next video.